Introducing the 462 Horizon Series stretchers with Airglide rails. The 462 APAST and 462 CPAST have patient surface of 28 inches, and the 462 DPAST has a patient surface of 32 inches for the bariatric patients. The 462 Horizon stretchers have a 500-pound weight capacity for the 462 APAST and 462 CPAST. The 462 DPAST has an impressive 800-pound weight capacity. Our stretchers are used for multiple procedures: patient treatment, transport, and recovery. 8-inch Tente casters and central brake and steering come standard on every unit. This system makes steering and braking easy and safe for staff and patients. Red pedals are for braking, and green pedals are for steering. Pedals are conveniently located on all 4 wheels. The caster braking system should always be locked when patient is not in transport. When patient is left unattended, the caster braking system should always be locked and patient side rails placed in upright locked position. To engage steering mode, fully depress the green pedal. The 5th wheel deploys, allowing for easy mutability and steering for attendant. To release the 5th wheel, or steering lock, depress down on any of the 4 red pedals until it is parallel to the floor. All 4 casters will rotate and swivel freely. To adjust height of stretcher, press pump pedal to the floor until desired height is achieved. To lower patient surface top, press down on the 2 release pedals at the same time until the litter is at desired height. For enhanced patient comfort and safety, all 462 Horizon Series stretchers with Airglide rails have 16 degrees Trendelenburg and 16 degrees reverse Trendelenburg. Achieve Trendelenburg by pressing down on the release pedal closest to the head end until you have reached the desired position. Achieve reverse Trendelenburg by pressing down on the release pedal closest to the foot end until you have reached the desired position. To activate the Fowler position, grab the Fowler frame tube and the red release lever, then lift up the Fowler until desired height is reached. Lower slightly until ratchet is engaged. Make sure the Fowler position is locked by pushing down slightly on the Fowler. To stow the Fowler position, pull the red release handle toward the outer edge or the back section to release and stow. The standard IV pole is located on the right center of the crossframe at the head end of the stretcher. .462 Horizon Series stretchers allow for full-length patient protection with side rails that are higher and longer, allowing safe patient transfers with 0 transfer gaps. The Airglide rails can be raised from under the patient's surface firmly, then pull up until rail locks into full up position. In order to lower the rail, pull out red tab located under the patient's surface at the head or foot end, and then bring down the rail completely under the patient's surface. The 462 Horizon Series stretchers with Airglide rail feature an easy-to-clean thermoformed base cover with O2 tank holder and ample storage space. Contact your Hausted representative to see how the Horizon Series stretchers with Airglide rails can streamline your caseload and transform your OR.